Today we'll be going over the Biohealth Female Hormone 208 test kit. Before we get started, just make sure that all the kit components are in the testing kit. You should have 17 collection vials, 17 information labels, a biohazard specimen bag, patient submittal form and patient worksheet, ice gel pack, a specimen collection and transport kit, and the UPS laboratory pack and return shipping label. Read all the instructions in the kit carefully. Do not deviate from the collection schedule indicated on the patient worksheet. Place the ice pack flat in the freezer at least 24 hours before shipping these samples. This test requires the use of a digital thermometer, which is not included in the kit. Drink plenty of water the day before collection to improve oral hydration, and practice collecting saliva if you haven't done so before. You can rinse and dry the vial after doing a practice collection. The collection restrictions: 1 hour before, do not brush your teeth, do not use mouthwash, do not eat or drink, and do not chew gum. On the collection day, avoid taking hormones, do not drink caffeine, do not drink alcohol, do not smoke, do not exercise heavily, and collect saliva before taking any medications or supplements. For the collection schedule, cycle day 1 is the first day of your menstrual bleeding cycle. Collect your first sample on cycle day 2 and continue to collect every other day until the first day of your next cycle or until cycle day 34. Perform your collection first thing in the morning within 30 minutes from waking up. Collect before taking any medications or supplements. Beginning on cycle day 2, record the date collected and your temperature every day in the included patient worksheet chart. Using an oral digital thermometer, check your temperature each morning upon awakening before getting out of bed. Record temperatures on the included patient worksheet for each day, starting on cycle day 2. Sample collection steps. Rinse your mouth thoroughly with water and wait a minimum of 15 minutes before collection. Fill out the patient information label using a pen with smear-proof ink. Let the ink dry before placing it on vial. Uncap the collection vial and hold to your lips. Tilt your head forward and allow the saliva to naturally pool under the tongue. Avoid clearing, throat, and expressing phlegm into the vial. Fill each individual vial to the 3 milliliter mark. If any bubbles appear, tap lightly on a hard surface to reduce the bubbles. Cap the collection vial firmly and affix the patient information label onto the vial. Freeze the samples as soon as possible. Place the vial in the biohazard bag and keep frozen until all samples are collected and you are ready to return shipping. Insert your patient submittal form, when filled out completely, into the pouch located under the lid of the specimen collection and transport kit. Place the biohazard bag containing your collection vials into the box. Place the frozen ice gel pack on top of your samples, and then replace the insulated styrofoam insert lid. You can then put your expanded patient worksheet into the box, close it, and then you are ready to ship. Open up the UPS lab pack. seal shut, put on the return label, and then return to your UPS drop box. If you have any questions, feel free to call our office and we will be happy to assist you.